but now we heard about the patina trial. So I think that's bringing the CDK4/6 inhibitors into the HER2 positive setting. Is that right? Can you say a few words about that?
There's a couple of trials that are looking at adding in CDK4/6 inhibitors in the ER positive, HER2 positive metastatic setting. So patina is one with palbociclib. So patients have induction treatment and then they get randomized to either standard anti-HER2 therapy with endocrine therapy with or without palbociclib. And then Neo-Monarch, which I think has been open a little bit longer, has a pretty similar design using abemaciclib in that setting. If you look at Pertain, I think the bar is quite high for that because what always surprised me about that study was that the progression-free survival in the trastuzumab endocrine therapy arm was much longer than what we'd seen in prior studies, which I've never been able to explain. So I think it's going to be very interesting, but there is certainly preclinical data suggesting that the CDK inhibitors should work in HER2-positive disease.
So the patina is an ongoing trial
Correct.
At this point. We don't have data yet.
We have data from neither of them at this point.
I've heard the accrual was not great on that study. Do you guys know anything about that?
I think in general we are doing so well in the neoadjuvant adjuvant setting that
There's no patients. Yeah.
Those triple positives.
Yes, it's mostly de novo metastatics. And,
Right.
And but we do tend to, utilize in the ER positive, let's say de novo metastatic, we'll use a Cleopatra-like regimen, stop the chemotherapy, keep going with trastuzumab and pertuzumab, and then add endocrine therapy, usually, as per the Pertain trial.
But in the Pertain trial, even in the group of patients who didn't get induction chemo, their progression-free survival was very long, much longer than what we'd seen before. So I don't know if anyone can explain that.
Patient selection, maybe?
But why would it be so different? I don't really understand.
But that was with pertuzumab, trastuzumab, and...
But even the control arm, the progression-free survival was 15 months. Remember, in the older study, it was like 3 months or something, or
and
5 months.
The analogy was tandem, right? That would have been the control. Tandem, right.
Yes. But so that's going to be interesting to see if there is a, it ought to be hopefully tolerable, because if we could make that truly a chronic disease, that would be obviously cool, because one mechanism of escape in the preclinical literature that I've looked at from CDK4/6, it can be, anything upstream from that can get upregulated, and if you don't have FGFR1 or something like that, you can upregulate the HER family, can be an upregulator. So it makes sense to block that too, it could really clamp things down, so it's great that those trials are ongoing in the metastatic setting,
And I would make a plug just because it's my favorite topic, but
immunotherapy perhaps? We're going to talk about that in a minute.
That CDK4/6 inhibitors can be immunogenic, and there's some pretty compelling preclinical data and some early clinical data supporting checkpoint blockade combinations with CDK4/6 inhibitors. So
right, which are ongoing, right? In the
which are
metastatic
ongoing,
setting.
exactly.
Yes,
exactly.
Cool.